Tactical medicine focuses on providing emergency medical care in hostile or austere environments. This module covers life-saving skills, emergency response techniques, and medical equipment handling critical for tactical operators facing injuries in the field. Principles of Tactical Medicine. Tactical Combat Casualty Care, TCCC, is a medical approach focused on providing life-saving care in combat or high-threat environments. Priorities in tactical medicine. Care is delivered in phases: care under fire, tactical field care, and casualty evacuation, CASEVAC, based on the threat level and situation. And very quickly, the role of tactical operators. Operators often act as first responders, providing immediate care to stabilize casualties before medical personnel arrive. Common tactical injuries. 1. Gunshot wounds and penetrating trauma. 2. Blast injuries and burns. 3. Fractures and blunt force trauma. 4. Airway obstruction and respiratory distress. 5. Hemorrhage and shock. Basic life-saving skills. 1. Primary survey. Airway, breathing, circulation, ABC. 2. Controlling hemorrhage. Direct pressure, tourniquets, hemostatic agents. 3. Airway management. Head tilt, jaw thrust, use of nasopharyngeal and oropharyngeal airways. 4. Chest decompression for tension pneumothorax. 5. Treating shock and hypothermia. Tactical medical equipment. I will mention the equipments, their uses, and key considerations. 1. Tourniquets. Control severe limb bleeding. Proper placement and timing. 2. Hemostatic dressings. Promote clotting and bleeding wounds. Ensure proper packing of wounds. 3. Nasopharyngeal airways. Maintain airway patency. Correct sizing and insertion. 4. Chest seals. Treat open chest wounds. Prevent air entering the chest cavity. 5. Trauma shears. Cut clothing and gear. Durable and easy to handle. 6. Tactical medical kits. Compact kits containing essential supplies. Regularly checked and restocked. Casualty evacuation. 1. Safe and efficient movement. Follow procedures that protect both the casualty and rescuers during transport. 2. Carrying techniques. Use methods like the fireman's carry, two-person drag, or improvised stretchers depending on the situation. 3. Communication. During evacuation. Clear, calm, and continuous communication is vital for coordination and safety. 4. Prioritizing under fire. Quickly assess and prioritize casualties based on severity and survivability while maintaining tactical awareness. Emergency response procedures. 1. Responding to active shooter incidents and mass casualty events. 2. Coordination with medical teams and evacuation units. 3. Scene safety and risk assessment. 4. Documentation and reporting of medical incidents. Psychological first aid. 1. Recognizing stress and trauma. Identify signs of emotional distress in casualties and fellow team members. 2. Support techniques. Use basic listening, reassurance, and calm presence to provide immediate psychological support. 3. Stress management for operators. Learn strategies to manage personal stress and maintain mental readiness during and after operations. Practical training. Our practical training would look at 1. Application of tourniquets and hemostatic dressings. 2. Airway management drills. 3. Simulated casualty evacuation scenarios. And 4. Role-playing emergency response and communication. Case study. Analyze a tactical medical response operation, discussing successes and areas for improvement in casualty care and evacuation. I believe from this module you have been equipped to understand the basics of tactical medicine and emergency response, perform critical life-saving procedures under pressure, properly use tactical medical equipment, execute safe casualty evacuation techniques, provide psychological support and stress management, and coordinate effectively in emergency situations. We would stop here for this module. I hope you enjoyed this module.